A highly anticipated use of genetic data will involve sequencing a single individual's DNA, loading it on the electronic health record server, and using an individual's own genome to guide their care. Have a genetic predisposition towards heart disease? Your EHR will advise your healthcare provider on your LDL goals, aspirin therapy, blood pressure goals, and will flag the records of your relatives. Have a genetic sensitivity to Coumadin? Your EHR will alert your prescriber so that it is avoided. Given our new $1 trillion healthcare reform, you might be wondering how we will afford sequencing the DNA of all American citizens at $1,000 a pop. But what if this intervention actually saved money for a change? What would it be like if you didn't have to spend $1,000 every 10 years for a colonoscopy when you have no risk genetically of developing colon cancer? What if you didn't have the gene for prostate cancer and didn't get PSAs that resulted in transrectal biopsies? What would that save us? What if we could do a simple computer search for a perfect bone marrow donor for you, and there were thousands of possibilities returned? All of this information is going to require that all providers have a better understanding of genetic disease and familial relationships. Aren't you glad that this is in the future and that you don't have to worry about this now? Well, too bad, because the future is here today. Check out the website 23andMe. This commercial retailer specializes in genetic analysis for a fee. All you need to do is spit in a little cup, mail in your saliva and $400, and get your report. Families of customers can participate and be linked so that important familial relationships can be explored. The customer is given a list of elevated risks. They will, of course, bring this to you. Some of you have experienced the patient that is alarmed by a finding on a roving radiologic laboratory that visited their church, ultrasounded their abdomen, and said that just maybe they saw something that suggested a small aortic aneurysm that you get to work up. Coming soon to your clinic is the patient is concerned about their elevated risk of gout. Dr. Nurse Practitioner, I have an increased risk of restless leg syndrome. Tell me what to do. And what to do with the patient with an elevated genetic risk of colorectal cancer without a significant family history. Do they get a colonoscopy at 50? At 40? Today? Right now? The ability to sequence an individual's genome will result, at least in the short term, in new healthcare disparities. The good news is that technology simultaneously tends to decrease in cost as it increases in complexity. In time, this technology has the potential to be as widespread and inexpensive as an iPhone. And of course, this is just one little baby beginning of the ethical issues. Take a look at the Genetic Information Non-Discrimination Act of 2008, designed to keep people from having this information used against them. Consider as to whether you think this satisfies all of the risks. If individualized medicine comes to fruition, it's going to revolutionize the way care is delivered. We currently base our preventive wellness care on population health models. If you're 40 years old, it is recommended that you get a mammogram for the first time based on cost-benefit ratios of entire populations of women, not you as an individual. Individualized genomic-based healthcare will throw that entire model right out the window. And all of us will just have to adjust on the fly. The time to start getting ready is now. Check out these competencies developed by advanced practice nurse educators on behalf of the National Coalition for Health Professional Education and Genetics. The future is coming. What a great opportunity this is to advance our educations and take an active role as DNPs. So with this information in mind, we'll focus on the implications for advanced practice nurses and our patients. Our objectives are, as you see here. As you learn more via the readings, please consider the following 2 questions. What are the implications for both patients and advanced practice nurses on the eve of the implementation of these new technologies? And what ethical dilemmas and future disparities will exist? Can we do anything to prevent them now? Thanks for listening, and I look forward to your stimulating discussions on this topic.